Describe your procedure for feeding an infant.
Okay. I have 3 infants in my care. They're basically all fed the same way, but I'm going to go through how I feed my own daughter, Ripley. The first thing you're going to do with all your infants is to make sure all their bottles are labeled with their name and the date. You also want to make sure you wash your hands. When you get your infant bottles ready, you're going to want to fill the water up to however many ounces that child drinks. And you're going to look in the back label of the formula to make sure you put the correct amount of scoops to correspond with the ounces. Typically, it is 1 scoop per 2 ounces. After that, I will grab my daughter and we'll go to the rocking chair and I will hold her like this and feed her. I burp her and all the other children every 2 ounces. Then after she has her bottle, I take her over to the high chair and I feed her her cereal and fruit or veggies. During the whole time I'll talk to her and try to keep her attention and keep her engaged in the feeding. And then at snack time she usually will get puffs and she can feed herself during that time.
Can I ask you how old Ripley is?
She's 9 months old.
Okay, so Ripley has the pincer,
She has pincer grasp. Yes.
And she's old enough to have the cereal and fruits and vegetables.
Yes,
okay.
Yes, and we're starting her on table food as well.
Okay.
So, and then I also have a 4-month-old who's only bottle fed, and she's fed on demand. But I have another child who's also 9 months, and her parents and I had a conversation how they kind of want her to be on a set schedule. So I listened to her parents' request and try to stay on that schedule, but if she starts crying and is wanting the food, I'll feed her earlier and I'll just write all the food, I write everything down for the parents so they know that she was fed earlier that day.
So you put the time down and then how many ounces or
yes,
how much food she had at that point.
Yes.
Okay.
Yep.